Hey guys, welcome to Prasu'S Medledge. I hope you all are doing good and have watched my previous videos. If not, what are you waiting for? Go for those after the end of this video. Now, without wasting any time further, let's get into today's topic. So today I'm going to discuss with you aortic stenosis, which is a aortic valve disorder. So aortic stenosis is defined as abnormal narrowing of aortic valve, that is its orifice narrows. Okay, so basically the orifice area of aortic valve narrows. So the etiology of aortic stenosis includes rheumatic heart disease, then aortic sclerosis, that is fibrocalcific deformity of the aortic valve, then systemic lupus erythematosus, infective endocarditis, then congenital aortic stenosis, that is which is present since birth. Next is hypoplastic valvular annulus. Okay, so the annulus of the aortic valve will be hypoplastic. Okay, next is hypoplasia of aorta, that is improper development of aorta. Coming to the clinical features, we have symptoms and signs. Usually, the patients with aortic stenosis remain asymptomatic for years. So, the first symptom to develop will be basically decreased exercise tolerance. So, it can be either exertional dizziness, exertional syncope, and exertional breathlessness, that is exertional dyspnea. So, first symptom which usually develops in these patients after remaining asymptomatic for many years is decreased exercise tolerance. Okay, then coming to the signs. So signs include heaving apical impulse. Then there is cardiomegaly, which develops later with left ventricular dilatation and left ventricular failure. Coming to the auscultation findings, the aortic component of the second heart sound, that is A2, is delayed in case of aortic stenosis, and this results in a narrow splitting of the second heart sound because A2 comes before P2, that is pulmonary component, and since the A2 is delayed, so the interval between A2 and P2 decreases, and as a result there is a narrow splitting of second heart sound. Then we can also hear left ventricular third heart sound in case of left ventricular failure. Now coming to the characteristic murmur of aortic stenosis. It is a crescendo decrescendo ejection systolic murmur which is best heard at the aortic area and is conducted to carotids. So crescendo decrescendo means initially there is an increase in intensity of the murmur, and then later on there is a decreased intensity of the murmur, that is decrescendo. Okay, coming to the investigations. So on chest radiography, the heart will be of normal size. Post-stenotic dilatation of aorta is seen. Very important point. Then we can see the calcification of aortic valve. Then on ECG, we will see left ventricular hypertrophy. And in echocardiography, we can do the accurate assessment of the aortic valve area. And we can also look for the left ventricular hypertrophy and ejection fraction in echocardiography. Cardiac catheterization with coronary angiography is also done in case of aortic stenosis for the purpose of diagnosis. Now coming to the treatment, first is avoid strenuous physical work, and for asymptomatic patients we have to do monitoring. Surgery is advised when the patient has moderately severe aortic stenosis with symptoms or signs of left ventricular failure. So the surgeries which can be done are aortic valve replacement, that is the surgery which is mainly done, and aortic balloon valvuloplasty is done in case of congenital aortic stenosis. So this was about aortic stenosis. I hope you like the video. If you like my content, please do like, share, subscribe and comment, and also press the bell icon to get notified whenever I upload a new video. And you can also click on the playlist which is shown on the right side to look for other valvular heart diseases. Thank you.